Good morning. I am Admiral Levine, Assistant Secretary for Health at the United States Department of Health and Human Services. Thank you so much for inviting me to join you today. We have all faced a very difficult and challenging time. COVID-19 has been taxing physically and mentally, especially among our country's most vulnerable populations. But we've all felt the strain. COVID-19 was particularly challenging for public health professionals, like many of you. Our work was suddenly front-page news, and it was our responsibility to lead the pandemic response at the federal, state, and local level. While it certainly can be disheartening to see a public health issue become politicized, I want to tell you that your work matters, your time matters, and you matter. I want to pause and thank all of you from across the country, your staff, and by extension your families, for the extraordinarily difficult work you've been doing since January 2020, supporting the public health response to the pandemic. You have my personal gratitude, as well as the gratitude of the entire U.S. Department of Health and Human Services. One important lesson of the pandemic is that we are all interconnected, and we need to ensure that a healthier future includes eliminating health disparities and promoting health equity. Despite the heavy toll it has exacted, COVID has also reminded us of a fundamental truth, that we all need each other, that our happiness and literally our survival depends on our connection to one another and to our community. That spirit of community is what makes our country great, and it is what we need now more than ever as we seek to bring this pandemic to an end. Another important lesson is the profound importance of public health. We must ensure that local, state, national, and international public health authorities have the resources, the workforce, and the IT capabilities necessary to protect the health of our nation and the world moving forward. I take time in every presentation to encourage everyone in the audience to get your COVID-19 vaccine and help others in your community get vaccinated as well. The more people that are vaccinated, the quicker we can put this pandemic behind us. The COVID-19 pandemic has also brought into even sharper focus the health disparities of the Black, Latinx, and American Indian, Alaskan Native, and other historically underserved communities. The fact that this pandemic has affected some communities far more than others also underscores the profound disparities in health that have plagued our nation for far too long. While we work to tackle the pandemic, we will not take our foot off the gas when it comes to preparing for any future public health challenges. We must invest in growing our nation's public health workforce today to better meet the needs of tomorrow. And as we work to expand talent, whether it's in the field of health communications or public health informatics, we need to do that with an eye towards promoting diversity. I would like to highlight the importance of diversity. Diversity for a school, a medical center, a business, and government, and every organization. I strongly feel that diversity, in all of its myriad and wonderful aspects, should be welcomed and even celebrated for the way that it strengthens and enhances any organization. I encourage you all to embrace and emphasize diversity in your current roles. All Americans deserve services that are timely, affordable, accessible, equitable, and high quality. Of course, these are our family members, our friends, our neighbors, students, and co-workers. As a nation, we can and we must do better, and we will do better. Now, illness, deaths of loved ones, and prolonged social isolation as a result of the pandemic have impacted lives across the world. The accompanying stressors and trauma have also had unique implications for substance use trends and among people with substance use disorders. So I would be remiss if I did not briefly touch upon the overdose crisis facing our country. Today, people living in America are being harmed by a wide variety of substances, most notably synthetic opioids like synthetic fentanyl compounds, but also stimulants like methamphetamine and cocaine, and other drugs often used in combination. HHS recently announced a new overdose prevention strategy that fully addresses the spectrum of drug use and addiction that can result in overdose and death. The new strategy focuses on people, accelerating and amplifying access to proven opioid use disorder treatments, overdose prevention interventions, and other diverse substance use treatments and supports, while continuing to develop new, innovative solutions. In conclusion, I also urge you not to forget to take care of your own mental and physical health during these challenging times. A valuable lesson that everyone needs to remember: take time to care for yourself too. Now, I am a positive and optimistic person, and I believe that we can work together to come out of this stronger and build a better future for our nation's health. Thank you.